Hello, everybody. Welcome. We are live here with our sponsor, ProCare Health, and me, Brenda, and we have Katie joining us today, Katie Chapmon. Oh my goodness, I'm so excited to have her back. Katie has been with us now. I don't know how many events. I'm going to say maybe.
I think this is 5. I want to say this is number 4 or 5.
It very well could be. It's we're going on quite a few. I was looking for my notes to maybe see if I had written it down, but I haven't. I
Yeah.
know she's done several events with us on protein.
Yeah.
And you've done them on, I'm trying to think what else.
Oh my gosh. Protein. I think I did one on like vitamin deficiencies maybe.
Yeah.
It's just
been a while.
It's been a while. It's been a hot minute.
And she's going to be joining us next month. So right here and now we're talking about insulin resistance strategies. And I got to tell you why we brought this up. Hi, Eden. So good you're here. Yay. Say hi, you guys, if you're joining us. I'm going to also, my eyes are going to be on my phone for just a second because I'm going to sign on to our Facebook page. But so today we're talking about insulin resistance strategies. This is actually Nick's idea. Nick is our CEO. He's like, we need to bring this in. This is a good idea. So I reached out to Katie because I don't have that much knowledge of this. So I needed an expert. So Katie is an expert on this type of thing. And she's also an expert on hormones in general. And we're going to be talking about sex hormones at one of our events next month. So if you haven't already, Ina said, thank you, Nick. Yes, thank you, Nick. And he knows, he's like, just have Katie do it. She knows what she's doing. We'll have Katie do it because I don't know. Neither subject, insulin resistance or sex hormones after bariatric surgery. Neither one of those things. I mean, I have my own experiences, but I don't have the experience that you have. And also I want to say too, there is so many people out there right now that are kind of leaning on a lot of the weight loss drugs that affect this type of thing, insulin resistance. And so we're going to kind of like tip top on top of that, but we're also going to talk about natural ways to do this because not everybody has access to those medications or they don't fit into their lifestyle, into their budget. There's a lot of things. So these are some natural ways we're going to be talking about, but we'll hit on that just to kind of touch on it.
Yeah,
okay.
Absolutely. And I think too, like insulin resistance is such a term. And so I also want to help us understand what that means too. Like, what's the difference between that and like diabetes? Like, what does that actually mean?
Yeah. And I'm like interested to know. And she's simplifying it too, guys. So it's going to be easy for you guys to understand. She sent me her presentation and I think you guys are going to benefit from this, whether you think that you're insulin resistant or not, because you may not even realize that you may have some insulin resistance out there. Katie, I want you to start by telling us a little bit about yourself because I find your background so intriguing. She has actually been with the ProCare team for some time. She works as a consultant individually. She does speaking on a lot of different topics. She works with programs. She speaks at a lot of the national conventions. So I just want you to kind of zoom in here. Tell us a little bit more about yourself so these people know you. Even though you've been on here before, some of them may not be familiar if they're new.
No problem. So let's see. My name is Katie Chapmon. I'm a registered dietitian, and I've been a dietitian for 14 years. And all of those years have been working with people who are within the bariatric surgery process, whether they're considering it or are going through the surgery process before, during, after. I've been, all of my 14 years have been a part of that. And so I do have a private practice, and like Brenda was mentioning before, like hormone health and gut health. That was the other live we've done before.
Yeah, it was.
I just remember that because just in looking at people as a whole, and surgery, definitely is part of you as a whole person, but other things can also affect weight and just quality of life. So I kind of go into all of those different subjects within my private practice. And then I speak nationally and actually internationally at events to educate others on subjects such as this. So both professionals and then also people that are not in kind of like getting continuing education and in that professional realm. And I kind of, I definitely with ProCare love to join in on these lives and just kind of give some extra information that's really tangible and things that you can do and do at home. And as we all are continuing to learn more about like ourselves and what our body functions are and what they do and how to better ourselves after surgery, I always want to give that extra insight on some of these subjects that might be like, I've heard of it, but I don't really know exactly what that involves. So, little about me. Did I say enough? I hope. Oh, I can't hear you, Brenda. Hey, Brenda, I can't hear you.
I muted us because I was typing. I'm sorry. Good. She's probably going to crack up at me because earlier I didn't have my earphones on. I'm like, I can't hear you.
No problem.
I'm in a ditzy day. I was trying to go onto our Facebook page to check any messages or anything like that. So if you're joining from Facebook, say hello. I'll be kind of going back and forth from that page. That's what I was doing on the side. I wasn't trying to ignore what you're saying. So
not at all. I just wanted to make sure everyone can hear you.
So also Katie helps ProCare Health with a lot of our side projects that we're doing. We have a lot of new products that are coming out, new supplements. I mean, like probably 10. A lot of them are supplements that go along with bariatric surgery, but they're supplements for on the side. One of them we're going to be talking about today. So I'm not going to surprise you on that one, but there's some, I'm going to surprise you on that one. I'm going to say that'll be towards the end of the call, but you just have to go to our ProCare Health website and just take a look under vitamin supplements. And I'll show you where that's at here in a little bit. But what she does is she helps us with, tell me what all you do behind the scenes whenever we're working on products.
Really, it's just like honestly, almost of a pick of my brain, really just, I mean, whenever, and it's a lot of times too, what I think like what I look at with like people and just individuals too, is like, you're trying to go, hey, like what we're trying to solve or what we're trying to do with a supplement or with a product, is it hitting all of our marks? And is it what we kind of, need in the right kind of ratios or numbers or things like that? And so, I mean, I kind of take a look and almost it's at least for me, I always go like, it's just my brain, and I've been doing this for a while. So sometimes I'll go like, what? Like, are we covering all our bases? Are we doing what we need to do? And so that's kind of the I don't
gist
know.
Of it. Well, gist. And I know we need to get on going to our topic, which we will be, guys. But just for example, like we developed our protein powder. Katie was behind the scenes, like trying to make it her dream product because she's a dietitian. I'm being serious though. You were like, that's what I kind of tease about. Like Katie helped us make it be her dream product because there's certain things that dietitians look for. Here we have electrolytes, which is unique. We have being gluten-free. We have less sugars. We have really good whey protein isolate, which is recommended. So she was behind the scenes making sure that our products are just what is wanted by the professional side. They want their patients to have what they are. So thank you for that.
Yeah, I'm like easy enough of like, oh, what would I look for?
Yeah. We listen to her opinion because she knows. So anyways, let's jump in. Let's start our insulin resistance topic. Like Katie, when we ask you to do this, tell us what were the things, like what did you want to hit on and what are they going to expect from this conversation?
Yeah. We hear insulin resistance. So it's like, what is that? And what is the difference between that and diabetes? And also like, how are they interconnected? So let's simplify that. So we just kind of know like, what are we trying to support as people within our bodies? And then like you said, like, yes, I'm going to hit a little bit of like some of the medication side. That can be a whole other ball of wax. So I'm not going to go into it too much, but at least just in general. And then really, what are the things that we can do both from a nutritional aspect and from a supplemental aspect? What can we do to make sure that we're supported and supporting our bodies the best to not have insulin resistance or to keep that insulin resistance under control? Because I mean, my goodness, we are the masters of our own ship over here. So I really love to put, that in your hands too, of like, it's not just, oh, hey, I have this. And there's a ton of information when you Google out there that it can become confusing. So I wanted to drill it down of like, hey, what would my top 5 strategies be? And what would my supplementation or considerations of like, oh, if I'm deficient in that, or if I don't have a well-rounded multivitamin or something like that, like what would maybe be some concerns? So that's kind of how I started it.
And 2, there is actually, I see professionals on the call as well. So, this might help lead their practice as well, because we're all looking for insights to share.
Yeah. No, absolutely. And so, hi everyone. I mean, absolutely. It's something that can be really, really helpful. And again, just to get that better sense and to make it something that is tangible for all of you guys to do. So that's my gist. So I think I have some slides. We're going to cross our fingers on technology here. Is there any way, as far as I think I have access to share?
You do.
Okay.
So at the very bottom of the screen, you should see those buttons, the fun ones
The fun ones. Okay. So I'm going to cross my fingers here, guys. Give me 1 second. I'm going to be the masterful person in this.
Hey, and while you're doing that, Katie, I'm also going to share it. Guys, I am really excited about this. We really haven't done any promotions with it. Really, we haven't really talked about it much, but we are going to be very soon changing over from Crowdcast to Zoom, and that's going to change some things, Zoom webinars. And I'm really excited because we're also going to be taking those recordings. We're still going to continue our lives, but we're going to be taking those recordings. Everything will be housed on YouTube instead of being on the replays here, which we already have them downloaded. Nope, we don't advertise it, but know that you can always go to our YouTube channel, ProCare Health YouTube channel, and find all of our replays there. And we're going to be uploading everything as podcasts. So we're going to be starting to have podcasts as well, which I'm excited.
That's awesome.
You figured it out?
Awesome. I think so. All right. Okay. Hopefully. Are we seeing this?
Yes.
Oh my God. Okay.
Katie, can you see can you see me and you? Okay, good.
I cannot.
Okay.
No.
Okay. So I'll kind of keep you up on comments.
Please, that's what I was just going to say. If there's comments, anything, just interrupt me. I'm happy to further explain something, or just, if there's questions along the way, we can, take care of that or wrap up at the end too. So I'm such a visual person. So I like to at least have some slides so I can kind of visually explain things. It just helps me a bit, and I'm hoping it helps you a bit more too. So I wanted to talk through insulin resistance and strategies, kind of drill those down. So first and foremost, what is insulin resistance? So if we look at our cells, okay, so nice little cells here. In our cells, we have an insulin receptor and a glucose channel. So I always think like we have this little key and then we have a door. And so in our kind of usual insulin process or usual kind of cellular process with insulin, we have that blood glucose or that blood sugar bopping around. Our pancreas releases insulin. And then when it gets to the cell, that insulin is like a key and it unlocks that door to let glucose in and be taken in to our cells. That's kind of that whole process. So what kind of happens differently when we have insulin resistance is really we're looking at this whole cell part of the house, not as much our pancreas, but really the cell part. And that door is not really opening or that key isn't working as well. So if we just think about it as a door and a key, I think that really helps us to be able to understand just what our body's kind of doing. And we have so many cells, so it's not necessarily every cell that's having that difficulty, but some of our cells do. So why does this happen? So sometimes if we have a high amount of blood sugar and our body is really, really pumping out insulin, when we go to have that key and that door open, it's too much. There's too many keys. There's too many doors that have to open. And so our cells over time are like, oh my gosh, I'm out. Like this is too much. And so it builds up this like tolerance to those keys. And so those keys don't work really effectively. Maybe that insulin is less effective at signaling the cells to take up glucose. So what kind of meaning is that like, hey, that key doesn't turn all the way. So the key goes in, but it doesn't turn, so that door doesn't completely open, just opens partial of the way. Or our cells itself stop responding to that key. So think of it like that. Cells, they just, right? That keyhole is non-existent or is blocked, but that doesn't work. So all different ways that kind of happens. And usually this is over time and often happens, for many reasons, but sometimes it's just that kind of overload or maybe timing of too much at once, too much activity, blood sugar at once. And so that's kind of what happens on the cellular side of the house. So if I'm looking at the side-by-side resistance versus diabetes, just to help make that a little bit clearer in our brains, when I'm looking at insulin resistance, I'm looking much more at that cellular part of the house. So insulin gets released. We have our glucose, which is our blood sugar, in our bloodstream. And when it gets to the cell, the cell doesn't quite have that either door opening, the key doesn't work, something like that. When we look at diabetes and that whole process, sometimes that does involve some insulin resistance, but it really, really is where that pancreas comes in. And what happens is that there's more glucose, or we have glucose or blood sugar in our bloodstream. And at first, our pancreas releases insulin to be able to make sure that we have enough to take up that blood sugar. And in someone who has diabetes or in a diabetic state, our pancreas doesn't produce as much insulin. There's quite a few reasons why that is, but it's just that more of that insulin effect. There's not enough insulin to be able to have enough keys to get to the door. So that's kind of where that difference is between the two. So what do we do, like medication wise? And again, this was my kind of brief part with this. So I put some of the major names in here, but so typically how they approach it is some similar medications that would be prescribed for someone who does have diabetes or has that medical diagnosis. And really it's just trying to help either the insulin that's released from the pancreas and have that either stimulated or slowed down, or to make it the insulin more sensitive to connect and to open that door and help with that key. And so what I kind of put in here, like typically we have oral medications. Metformin's probably the most common. The other one, which is that super long name, and I put it in there just because I kind of was thinking sometimes people hear it as this, sometimes people hear it as Actos. That's probably the more common name for that one. And so I will say that typically metformin is used for an oral medication.
Hey, Katie,
now, when
quick question for you here. How many people would you say that undergo bariatric surgery have some form of insulin resistance? I know we don't really tell them that, but how many people, and how many do you think? I mean, there's a lot of diabetics, because I know whenever I worked as a coordinator for the bariatric program before ProCare, I mean, I would say huge percentage that were diabetic, maybe 50, 60%. I don't know what you would say, but how about insulin resistance? Both.
Yeah.
I don't know if there's
I would
statistics out
combine it.
there.
Yeah, I would combine it kind of together, because oftentimes insulin resistance and diabetes kind of go hand in hand. It's like you can have a little bit of both. And so I don't have exact numbers off the top of my head, but I would say probably about 70%.
Wow.
Yeah.
With which one or both?
I would say both.
Both. Together? Like,
Together.
And how would somebody know, maybe you're going to go over this, how would somebody know if they haven't been diagnosed as either? How would they know?
So when, I'll say it, there's not like, hey, we're taking your cell and we're looking at the key in the door type situation. But what someone will see is they'll usually see their A1C, so that hemoglobin A1C number, which is your average of 3 months of how your blood sugars are. They'll see that start to go up. Now there's thresholds, or there's like, hey, if that A1C is between this and this, then that's considered more of a diabetes diagnosis. If it's between this and this, it's more of a prediabetes diagnosis. And oftentimes what they consider within that prediabetes range, they'll consider that insulin resistance. Now, if you go to an endocrinologist and they're like, hey, let's check pancreatic function and let's take a look at, like, does your pancreas release enough insulin? And those are some other further lab work. They can drill it down. But I'll say that most people, if they're just in general, they start thinking of like, insulin resistance, because sometimes that's what happens before the pancreas is affected. They'll start thinking through about that when someone's in that pre-diabetic range. And so hemoglobin A1C, that's that average of 3 months. You really ideally want it under like 5.3. And so if it's above that, then let's see, 5.3. Nope, they raised it up. So under about 5.5, under that, all right, if you're going 5.6, 5.7, 5.8 to 6, they consider that more of a pre-diabetes range. And if it's above 6, they consider that a diabetes range, just to give people kind of some average numbers to look for. So I can say like the testing part, sometimes they won't drill it out like is this insulin resistance versus pre-diabetes. However, how I would approach it and the strategies here today are going to be great for either one. Whether it's like a pre-diabetes diagnosis or an insulin resistance, it's just the lab work isn't always done just for insulin resistance to drill it out. Does that make sense?
Yeah, 100%. So
Yeah.
I went to my doctor recently, and if you guys are getting ready to have bariatric surgery, if you've already had it, hemoglobin A1C is one of the most common tests that they do before surgery, after surgery, to see where you're at, because it does matter. Like your treatment plan does matter, because it affects your weight loss. And so I actually had all my blood work done recently, and my hemoglobin A1C was 6.1. And they actually, I don't know if the guidelines are changing. He actually said, you're not diabetic. You don't fit criteria for any of these other medicines, this Victoza, Ozempic, any of those, Mounjaro. But he did tell me that, that I was in a range where I needed to be watching. So
yeah. And what I can say is like, that's why I kind of go like, here's one number, and where my hesitation comes is because there's other factors that they'll take into effect to be like, here's this diagnosis. And I'm going, oh gosh, okay, it's just like a more complicated conversation. But you're exactly right. It's like, hey, here's your A1C. We know your body might be having some difficulty with that sugar regulation in the bloodstream, but let's kind of back up and take a look at some other factors. Doesn't sound like you're popped into that category. However, just making you aware of like, oh, this might need some support or need some help with it. Yeah. So great question. Great question. I wanted to mention the injectables. There's one that they used to use all the time that was discontinued in January. So I'm gonna I just put that up there just because they're phasing it out for a lot of people. I even forget. I'd have to look up the common name for that. I don't have a lot of people on that. Usually most people are using what's called a GLP-1 inhibitor. And I put those on there of what the ones that are really utilized for and in the space of diabetes. So Victoza, Trulicity, Ozempic. Now, the other ones are like, and you mentioned like Mounjaro, they are a GLP-1 inhibitor. Explain what that is in a second, but they are in a higher dosing so that with that higher dosing, that's meant for a weight loss kind of medication category. So and so they might utilize that if someone needs assistance with blood sugar control and insulin resistance help or diabetes help and weight loss. So just a little different as far as category wise. A GLP-1 inhibitor, GLP-1 is just one of the hormones such as insulin that our body produces to help signal do we need to release insulin? What's happening in our bodies? It also can signal to our other kind of digestive hormones too, and our hunger and fullness hormones such as like ghrelin and leptin. So GLP-1 is a hormone. And so when you help to inhibit or help to slow down that hormone, then that also helps with our insulin and with our insulin response. So that's what that it kind of means and what that's used for. The thing with bariatric metabolic surgery is it actually changes several of our hormones. And depending on the surgery type, it might have an effect on assisting GLP-1. So that's in part also why and how bariatric surgery works, not just changes in what you're doing, but also some internal changes as well. I know, lots of great stuff, you guys. Okay, I'm jumping ahead here. So sorry. So my top 5 on insulin resistance, and I can say I would use this for anyone who just is trying to be like, let me really support my body with like blood sugar and blood sugar control. So whether that is insulin resistance, prediabetes, diabetes, or even just hey, I want to make sure that my body's got some support overall and I don't fit into any of these categories. Some things that you can use, and I narrowed it to my top 5. So one is fiber. So with fiber, and just think about like our vegetables, our whole grains, our fruits, especially ones that have like a harder skin on them. Fiber helps to slow down digestion. And so that limits or helps to slow down how quickly our blood sugar raises up. So that way it's not like a huge spike and our body's like, release insulin. And then when they finally get to that door and that key at that cell, there's a whole bunch waiting at that door, and it's sometimes too much to handle. Fiber helps to slow that down. So then that way it's a much more gradual process. So it's kind of like if we think of that door, it's much more of a like, oh, I have 2 guests at my door, and it's an easier straight line to get in. The second thing is the frequency of eating. So a couple things that helps do is, I always think that if I think of blood sugars and I think of eating, I want it to kind of go in a wave. So I want for people to eat a little bit and then it rises up a bit. And then we do kind of fall down, or we kind of go lower in terms of our blood sugar. But I don't want it to go so low so that we are hypoglycemic or have really low blood sugars, because then when that gets raised, it goes really, really high or really, really quickly. So that frequent eating about every 3 to 4 hours helps prevent that kind of back and forth. And also when you're really, really low, we tend to eat quicker, just subconsciously tend to eat quicker. So it prevents overeating too, as well. The other thing is like timed eating. So just meaning that we want to make sure that our window, and I'm not even actually looking as much of like an intermittent type fasting window, but we want to make sure that we have certain times that we're eating, and it's not just like grazing throughout the day. Because, if you go, oh, I'm walking by and I'm picking up a little thing, and even if that little thing is healthy, that does affect our blood sugars. And if we're constantly sending insulin and blood sugar to our cells never have a time to rest. So we want to make sure that we have certain times that we're actually eating. And that goes along with the frequent eating. But it should kind of be eating with purpose, let's say. And then the other thing that I can say is not having something so late at night that your blood sugars are really trying to regulate overnight. Now, I'll give this caveat that for some people who need some assistance with like more diabetes control, we might need something kind of near bedtime to help overnight. But that's something that I would have you work with your healthcare practitioner to determine if that's needed or not. For most people, we're trying to not have such a late night kind of eating so that you're having to digest overnight and work out those blood sugars overnight. My other
Katie,
two.
I have a quick question going back to that first slide or that other slide. Let me ask you this, supplementation wise, fiber.
Okay.
Fiber supplements are just food or both?
So I actually would do food more than I would fiber supplements. I can talk through a little bit about fiber supplements, but I would mostly do food. And the reason being is that with our food, we're including all the different types of fiber. So
Okay.
we have prebiotic fibers, we have soluble fiber, we have insoluble fiber, and we get a really nice mix of all of those when we eat it through food.
Okay.
When we do it through supplementation, even if like some of them are blends of like soluble and insoluble, they might miss some of the prebiotic fibers. They might be in like a really weird, kind of combination or not exactly the combination that we would want of soluble fiber versus insoluble fiber. And then you're also typically, because most of our fiber comes with our fruits and vegetables, you're also not getting all of the other little tiny nutrients, polyphenols, antioxidants that can also be really, really helpful from a sense of just digestion and then also overall health too. So I would lean towards my actual food. If that's proving to be difficult, then a fiber supplement can be introduced. There's all different ones out there. I can say I tend to lean more towards like a prebiotic supplement fiber. And what that means is that just helps to grow that helps with like your normal flora support in there. It does add some fiber too as well. And it tends to not feel like it's kind of like sitting. And I know that's the complaint for a lot of my clients who have gone through bariatric surgery is they'll go like, oh, I am using or I need a fiber supplement. And it just feels like it kind of just in my small stomach area now, it just feels like it like bloats or it just kind of sits. And so I'll either use a prebiotic fiber for that, or if I'm looking at my labels for fiber supplements, I tend to use like a wheat dextrin type fiber versus like a psyllium husk fiber, just because it's just a little bit more comfortable. Hopefully that answers.
Yeah, that was a lot more details than I thought. I wanted to just mention too, I got a little behind on timestamping, but I wanted to timestamp some of this in case anybody needs to jump off the call, know that I'm putting these in the question answer box so that they'll be timestamped so that people can come back if they have to pop off.
Oh, understandable. Yeah, no, there's always details that can be a little bit helpful too with some of this stuff and just making sure it's a little more comfortable, let's say. Other thing is maybe supplementation. I'm going to talk through some supplementation next. And some of that is just supporting even that like cell process and that cell support. And also fighting oxidative stress. So kind of like I was talking about antioxidants before, I think of kind of oxidants in our body kind of act like a pinball machine. So they that ball pins against our cells and kind of goes ping, ping, ping all around. And what can happen is that kind of just to our cells, it's a little damaging and causes some stress, which just makes it not as effective. So we like to have those antioxidants, whether that's through food and somewhat supplementation too, to just help support ourselves better. And so they're less stressed out. And then, physical activity. So it helps because that moves some of our blood sugars into our muscles. So our muscles are kind of that secondary storage. Those muscular cells are secondary storage for blood sugars. And also with improving that kind of resistance training that helps support our muscular tone a bit better and helps for that upkeep with our blood sugars, just versus aerobic activity. When I look at physical activity, I'm like, oh, even that aerobic activity. So aerobic just meaning it causes more breath. we're trying to get in that oxygen. So even if it's like a really great walk, that is going to help. Absolutely with our blood sugar and blood sugar control, because it helps to move blood sugar through our system. But I always tell people, like, if I'm looking at my comparison, I'd love a little bit of both because they each help to do different things. So that resistance training can help build up those muscles and that availability for taking up blood sugar secondarily. My top 5. So
Hey,
move
Katie,
around,
there's
supplementation.
actually, oh, go
Yeah.
ahead. Go ahead. I'm sorry, I didn't
I
mean to
was just
interrupt.
going to repeat real quick. So just think physical activity, considering maybe supplementation, my fiber, my frequent eating, and then making sure that I'm timing out my eating so I'm not just kind of running through my days with without eating with purpose. Question, yeah, for sure.
So on Facebook, we actually have Charles asking, what foods are best in fiber?
What foods are best in fiber? Okay, so I'm typically looking, like, my top are gonna usually be my vegetables. Those are gonna be typically the top ones, or my grains that are a whole grain. And I look at some of my more like my grains that are going to be a bit like nuttier in flavor, or that are going to be a darker color, meaning like a farro or a whole grain rice, or a brown rice. So I'm looking for that, like, kind of, I always think like the color helps me to decide things.
Yeah.
So that deeper color. And then with my vegetables, they all range, but if I look of ones that have more of some harder pieces to them. So I think like kale, I think asparagus actually gives us some really great fiber and prebiotic fibers in there. I think through even my cruciferous veggies like my broccoli and my cauliflower and Brussels sprouts. There's definitely, if you Google, there's lists of like, here's the top in fiber, and it'll give you categories of all of that. But the other bottom line is definitely, if they're a hard thing for you to eat, or you're not used to eating them, then just start somewhere. Start with what you like, because it may not be the highest, but it's still giving you a bit of fiber.
So Katie, one other thing too is I'm thinking like lifestyle. Like if I was wanting to implement these things into my lifestyle, what I would look at doing basically is by your list is I would try to eat more fruits and vegetables throughout my day. I would plan my meals out and maybe stagger them, maybe have a meal at 8 o'clock, 10 o'clock, noon, 2 or 3, 6 o'clock, maybe one right before bedtime. Add some protein in there so that you're balancing to keep your blood sugar more stable. Maybe not try to eat too late at night. And then supplementation, we didn't talk a whole lot about. I don't know if you're going to go into that, but
I'm going there next.
Yes,
actually.
I figured.
So we'll talk.
Then the physical activity, I think the recommendation through the ASNDS is 150 minutes a week. If you're not quite there yet, I would say just do the best you can. Some walking, and then the resistance training, as you start adding some of that in, add a little resistance, like either bands or lifting weights, or using your own body weight, like push-ups and things like that.
Absolutely. Okay. And those can also be done against the wall if utilizing, like you said, push-ups. I'm like, oh gosh, that's, sometimes really, really tough.
That's hardcore.
So I kind of will go like, oh gosh, use the wall, and that's all perfectly fine. It's just wanting to add that in. Yep. You're exactly right. For sure. So let's talk about supplementation. Okay. So, and I went through more of my nutrition basics kind of. Um, I completely forgot that I had this section. I was just so involved in my top 5. So I did kind of put in here some of my foods and some of my sources of fiber. But I also always like a really good list. And I think my easiest thing, even if I have a list, I look for color. I'm always like, a bright color will help me so much get in those different antioxidants. So the color of foods help tell me what polyphenols in there and what antioxidants that I'm getting in. And then looking for those brown, or like if I'm looking at whole grains, looking at that kind of much more rich brown color. The other thing that you mentioned is the lean protein part of it. And that's absolutely, and I didn't go into that too much just because I know protein's so part of the plan after surgery. I wanted to at least add some other full circle parts with that. But don't forget that your beans and your legumes are actually a really, really great source of fiber, protein, and they're considered a complex carbohydrate because of that fiber. So they add actually a lot of nutrition. So don't forget about those guys. And then with your fruit as well, those can, and especially I think through, if I have anything with a harder peel, that helps me with the fiber aspect as well. Okay, so let's talk about supplementation and a little bit of like micronutrients, because there are some micronutrients that can actually affect blood sugar and blood sugar control, and then also cellular function. So the nice thing is, if I look at all of these here, those should be included in robustly in your multivitamin after bariatric surgery. And then calcium would be separate on all the side. But in thinking through of like, oh gosh, okay, I'm making sure I'm covering my bases after surgery. If we're not having, if our vitamins and minerals aren't consistent, and if it's not as robust, then that can be involved in just seen with that insulin resistance. So some of the deficiencies here, we do see vitamin D, if that's deficient, that does affect as far as glucose metabolism and the ability for that cell to take up that insulin. So it affects that key part of the cell. Our B vitamins actually help regulate our cellular energy and keeps them energetic and stress-free. So that way they can open that door easier. Calcium helps to work with vitamin D, but we also see if that is low, then that actually doesn't help with our glucose going through that door. So calcium is kind of, I always think of that as part of like our knee-jerk part. Insulin, that key may go in, but calcium also helps with that cell door opening. So with that being low, then that can actually not support us as much. Magnesium actually helps with the glucose into the cell. So again, that door part. And then with zinc, that helps with making insulin. It helps storing insulin and making sure that insulin is sensitive. So just meaning that insulin gets the clue that it needs to open the door. So all of those should be included in your multivitamin, and of course calcium separate, but just making sure that our vitamins help us in more ways than just potentially what we think about. So other supplementation that I think through, just in terms of helping, or maybe what I would want to help with for cellular support, but also support of insulin resistance, would be an omega-3 fatty acid. And so we do think of it with our heart health, but we also kind of take a look here that yes, it helps with cardiovascular health, such as cholesterol and triglycerides and stuff like that. But we actually see that it helps with that cellular um, function, and it improves insulin resistance with having a quality omega-3 fatty acid. So yes, we kind of think like our fattier fish, which may be like a salmon, that's the first thing that comes to mind. I also think of some of the smaller fishes too, such as anchovies, sardines, tinned fish, that might be helpful, or our supplementation that comes from something like that, or an algae form. Those are both available as omega-3 fatty acids. The other thing that I know has been much more talked about more recently with kind of control or helpful for insulin response in the cell is inositol. So I wanted to mention it just because I do get some questions about this. Inositol is considered kind of like a B vitamin adjacent. It's a chemical compound. It's in some of our foods, but that helps to stabilize our response in the cell. So what I kind of see it most helpful with is that when insulin is that key that turns, inositol helps to make sure that door opens on that cell. So it helps for that response and to really make sure that it's stable. And so, just kind of some things to be aware of. There's usually a ratio with the type of inositol and stuff to consider with supplementation. I usually do try to personalize these if I'm going to recommend inositol for people. The common kind of thought process with it is about 500 milligrams twice a day, and usually best in like a powder form. And then just know that if it's really high doses above that 1,000 milligrams for a prolonged time, that has been seen to not be helpful with insulin resistance, and especially in with someone who has PCOS. So I wanted to kind of, before people start to go out and buy things, all my kind of fair warnings of making sure that you're having a partner to do this with. That would be my top ones for supplementation. So just remember that insulin resistance usually happens before diabetes. Like, they oftentimes go hand in hand. My approach actually would really be the same. And I would want to support that cellular function. Just think the nutrition part, the top 5, the things that you can do, and the consistency of that actually really helps. So I tell my clients a lot of times that, I'd much rather us be consistent with, let's say, going for a walk like 3 times a week versus, 1 week it's 6 days, and then the next week it's nothing. And then then we do like 1 or 2 days. And I know life happens, but if it's that kind of consistent more window, that's a little bit more helpful. And that goes along with our nutritional stuff too. Days may not be perfect, but are we kind of eating around the same time? And we have a little variation maybe with the timing versus a big variation. And just consider some supplementation. I look at your multivitamin, make sure that that's all complete. Maybe consider omega-3 fatty acid. And at least I wanted to consider the inositol, or at least talk about it, just because I'm getting more and more questions about that one more recently. So I wanted to bring that to the table. But you may want to get some assistance with adding that as part of your regimen. So I know we might have questions, and I wanted to make sure that we have, timing here too. But I have my contact information up there if anyone needs to chat with me or get in touch with me. And then, Brenda, I hope I answered everyone's questions. But
oh my gosh, yes. I don't see any more questions on Facebook, and I don't see any questions right now here in our Crowdcast. But I want to say, if you guys do have anything, please post. And Katie, you also do one-on-one evaluations. Is that open to this community?
Oh, yeah.
Okay.
Absolutely. Absolutely. If you feel like you could use some assistance or just be like, oh gosh, okay, I want to make sure things are run through, by all means, reach out to me, and then we'll just be able to chat through what's needed and some next steps. So absolutely. I'm happy to help.
Thank you. That's wonderful, because sometimes people get into points, and I think sometimes we don't always recognize, like, our stalls and things that we have going on. Sometimes it helps talking through those with another person so that they can help us better see something maybe that we weren't seeing in our diet
Yeah.
or whatever. So if you are struggling at any point, whether it's you have questions pre-op, maybe you have questions post-op bariatric surgery,
Sure.
Katie is wonderful. Like I said, our company relies on Katie for a lot of information. I think it's funny too, Katie, because you also mentioned, she's like, well, I'm going to be talking about supplements. And she's like, maybe you should talk about your new omega-3. So I kind of feel like it's funny. I already had that down without even knowing that it would help, knowing directly that it was really helpful, like on this standpoint. So I think it's funny because we've been doing a little, I'm going to share. Do you care if I share my screen, Katie?
No, I'm going to stop sharing over here so
Okay.
then you can take over. Absolutely. Absolutely.
I think
No
it's
problem.
pretty funny. So we've been doing, let me see
I
here.
know you guys have been adding some different things, and yeah, for sure. It's, helpful to kind of know what's out there and what it's used for. And again, I always like to make sure that everyone is matching things up with what is useful and helpful and all of those things too. So,
Oh
yeah.
yeah, 100%. So the question is can you take an omega-3 after bariatric surgery? And I'm going to share this next slide. I
Yeah,
want to
you
just
can.
say one thing as a disclaimer. I'm making this full size so it's a little better. One little disclaimer, and you may want to add to this too.
Yes,
Some of
sure.
these tablets are omega-3. I haven't seen our capsule size, but I know in the past, working in the bariatric clinic,
Mhm.
sometimes people would ask about this. If you're right directly after bariatric surgery, sometimes these things, some of the fish oil, and again, I don't know what our fish oil look like. We'll go to the website right after that, and I'll pop
Mhm.
it up. This is brand new, guys, on our website. And sometimes certain pill size may be a little harder. There also are some contraindications for fish oil, which we'll kind of talk about here in a moment. But
Mhm.
Katie's kind of mentioned the things that to look for as far as helpfulness, reduced triglycerol, blood fat levels, lower levels
Mhm.
of depression. Also can help with joint stiffness and joint pain. I know I've heard of people who had joint issues. Their orthopedic doctor prescribed them something like this. Found this interesting. I was doing a lot of research on this. It's lessened asthma symptoms due to lower inflammation and improved mental
Mhm.
focus, symptoms of ADHD, protection against Alzheimer's. Um, so those were some of the things that I found, and I'm going to pop onto our website to show that as well. So if anybody is interested in kind of checking out the ProCare, and then I'm going to let you talk here, Katie, because I was kind of mumbling on. I'm going to copy this
No, no,
link.
no.
It's found under products, under vitamins, minerals, right here. And it's actually, when you go on this page, there's so many new products. It's going to be on page 2. So we're going to press next. And I actually have it open. So I'm going to go right here. It's one of the last ones listed. So Katie, talk about here on our page, we actually have some things that it helps. This is kind of showing a little bit. I don't know if we actually
Yeah.
have the pill size. Tell us what you
Yeah.
recommend on that.
Yeah, yeah. So, I mean, really, like with a fish oil, you're looking at DHA and EPA, and you're wanting to make sure that you have both of those included, and also a ratio of that included. So, I know on your site you guys have that ratio, um, which is great. And really, I will say the disclaimer. Yes, absolutely. Make sure with your surgeon, as far as pill size, that's, I think of that. I also think too, with any supplementation, kind of with any supplementation, you want to make sure and consider and just kind of consult with someone if there's going to be any interactions with any of your other medications. So there are like, I think through of like, oh gosh, okay, if someone's on let's say a thyroid medication, I'm really thoughtful that I don't want a supplementation 2 hours near a thyroid medication. So there's just some nuances. So always kind of, check in on that one to make sure that there's not any interactions with that. And then with fish oil itself, you mentioned a ton of things that it actually can help with, and really that omega-3 fatty acid or that fish oil or supplementation, what that really, really works on is that works on helping our body not signal. Okay, so helping our signaling in our body to be less stressed and to lessen inflammation. And what I think is that, whenever we have a really kind of stressed out picture, and that can be honestly for so many different things. Let's say we're recovering from something. Let's say we have an injury. Let's say we have a chronic condition such as, cholesterol or triglycerides or anything like that going on. And I say this stress in very general sense because there is that outside stress that we often think of too that can affect our bodies. A omega-3 can actually help to lessen that stress response and lessen that inflammatory response. So just think inflammation. I like to compare it to a puffy jacket that our body puts on when it's like, whoa, I don't know what's happening. Something's going on here. And so it's like, don't move, don't do anything. And so it helps to support that response and helps to support taking off that puffy jacket. So you're right. So we can hear with joint pain, it helps because gosh, if something's injured or has difficulty functioning, all of a sudden it's like, oh, around that joint gets really inflamed, to help it out and to help us know, slow down. This needs to heal. So I mean, definitely I look at it for just, even any of our chronic conditions, but I also think of it too with joint pain, with heart health, with artery health. Those are my main ones that I think of too. And then also the insulin resistance part.
We're going to have to also, yes, and we're going to also have to look at this inositol, because I actually had a surgeon this last week, just probably 2 days ago, and I'd never heard of that before. I had to research it myself. He's like, do you guys carry that product? So we may need to look at that to see if that's something we can add, because maybe a new trend of things, or has it been around and just not talked about that much?
It's been more talked about, I would say, probably in the last 2 years, which is why I'm like, oh, I'm getting more and more questions around this. So I at least like to, when I come on here, this is so informative and educational. That's in part what I like to at least say is oh gosh, okay, well, let's make sure that if there's something out there or that there's something we can, that's kind of word on the street, I at least want to mention it. So that
the latest drugs on the street, guys.
Yeah, the latest things. I want to at least make sure that I mention it of like what it is, what it does. Yeah. And it just seems to also maybe go, hey, take a pause before you start taking something. There might be some interactions or some things that need to be thought through and get some better guidance on that.
Yeah. It never hurts to talk to your professionals. And I would say even more so than just your bariatric surgery, the doctors who prescribe your medications, like maybe it's your primary care or your heart doctor or your orthopedic doctor. The reason I say that is because your surgeon, his main focus is typically your bariatric surgery. And that's where his focus is going to be. And not that that's a bad thing. He may be very educated in all these other drugs. Some doctors are. I mean, like this doctor this last week, he was all about supplements and he knew. But I know there are surgeons out there that their main focus is going to be bariatric surgery. And there's nothing wrong with that because that's what you want their focus on. But talk to whoever prescribed your medications for you to double check. That's what I would say.
Yeah. Yeah. So,
or your
yeah.
dietitian.
Yeah, that's what I was going to say. Or your dietitian too, can also be really, really helpful, or at least may be able to provide some additional information to help, connect with your doctor a little bit better too, if they're not familiar with something. And so it's just, we need a village to help all of us. So utilize that village for sure.
And I'm just going to say, I mean, for myself, like I said, I mean, I still, being in the role that I've been in, I have a lot of, I've been around this. I mean, worked in the clinic setting. I had a bariatric surgery, but I still have a lot of questions. And I mean, we educate on this stuff every day, but just like some of these new things popping in, and having somebody else to go over this with you and to maybe highlight things you may have not recognized or seen can be helpful. So thank you, Katie, very much. And I'm looking to see if I don't see any other questions. So I'm going to actually, Katie, I'm going to write my email. If you want to write yours in the chat,
sure.
I can put them both on Facebook. Or do you have a better way for them to contact you?
Sure. So absolutely. So I'll put an email on here too. I'll also put my website too. So on there, like I always, I have like my schedule on there. If someone wants to set up just like a meet and greet call and just to chat through, at least if there's something that I can help them with, I'm happy to do that. And just at least talk through next steps of what, I would think through. So I'm putting that in there.
And I'll copy it on over to Facebook too for our Facebook listeners. So
those are on there as well, if I can be of any assistance. And some things, I definitely can say that if it's in detail, then we will have to be an official appointment, but at least like I'll guide us of like, hey, we should, get that, like what I would think to look for and guide you through this. So.
Well, thank you. And thank you guys for joining us again. Have a wonderful rest of your day, Katie. We'll be going back into the green room right after this. So I'll just chat with you for a second. So stay on. The rest of you, enjoy your day and have a great rest of your week. Thank you for being here. Time is precious. So we appreciate that.
Yeah. Thank you.